remind you of that. So we'll keep working. Thank you. Thank you. With that, I think we got that back on schedule. Mr. Brutner, we've got the health department scheduled for 2 o'clock. 3 o'clock. So welcome, Mr. Brutner. Thank you.
An old-fashioned PowerPoint.
Ready.
That's not disc. Mr. Chairman, Commissioners, County Manager. I was asked to come today to present on some of the changes or challenges that we're facing in this year's budget, next year's budget. This is not because we were asked to come before a Board of Health meeting. Commissioner Higdon probably won't be able to speak to any of these points, I don't think, because we have not taken to the Board of Health yet. It's going to be part of the budget process when we take it forward to them. And again, I was asked by Derek to come today and present that. And I want to tell you up front that we already met with Derek and Lori to have some conversations. If you flip to the second page there, where it starts off with projected increases in revenue and expenses in FY 15 and 16, and read the line under that, this includes no new county dollars. We're not asking for county money. We are asking for some adjustments in this year's budget and next year's budget. This year's we'll do through the general budget process, through a budget amendment that you'll receive probably in the next month or so, we hope, when we receive the check from the state. So we're waiting on that. But again, no new county money. Basically, for several years now, the last 3, we've had some significant additions to our Medicaid cost settlement that we get at the end of the year. And our finance person, Tanya Hodgins, has worked very hard to make it so that we can receive those funds and expend those funds in the year they're earned. And we haven't been able to do that until this year. In past years, we've always earned a little bit of additional money, maybe $10,000 or $15,000. We've always had to ask to carry it forward to the next fiscal year to spend. And Medicaid cost settlement dollars can't be used to supplant any county money that's already projected into a budget. So we've had to carry it forward. So what we're going to ask in this is that we start next fiscal year actually budgeting the full amount, because in the last 2 years we've received in the range of $250,000 to $275,000 more a year in Medicaid cost settlement, and that's due to some changes they made at the federal level in what we can and can't claim in Medicaid cost settlement. But we'd like to start trying to budget that, to plan for it, rather than planning for it in the last month and a half of the fiscal year, having to carry money forward and doing a lot of one-time purchases with it. We'd rather do things that can provide more services to the citizens of the county. And one of those things includes some changes in clinical services, which will generate hopefully some additional dollars in our general revenue funds. If you flip to the next page, FY14 earned. Last year we earned $499,000. We only budgeted $212,000. We received from the state $449,920. And the reason there's a difference between the $499 and the $449 is the federal government, or excuse me, the state DMA holds on to 10% of our cost settlement until they can reconcile the cost settlement. And we've now got about $128,000 sitting there that they have yet to reconcile for us. And that's a statewide issue. It's not just us. They haven't reconciled with a single health department on their 10% holdback. Again, $212,531 is what we budgeted. Received $225,000 in addition to that this board approved for us to spend on one-time expenses and on some recurring expenses as long as we continue to earn the Medicaid revenue to cover those services. If you flip to the next one,
yes, sir. Long discussion you had, you and I have had, to go back and adequately fund the local health departments. The Virginia statute says they must do that. Apparently they don't read that part. But I know the Health Directors Association, and we did have long discussions. Those services that are considered mandated by the state, that are not, as you took a cut last year, you have more mandates now than ever. So to reverse those and bring them, if we should be successful
if the legislature should decide to do that, I don't know if you have that number off the top of your head, but it would be substantial in our local health department, true.
We would hope so. It would depend on how the legislature tells the state to distribute those funds. If they put it into the state and allow DPH to do it, it can be distributed based on their current formula, which was, I think, created in 1972. But we're hoping that the legislature will distribute it equally among, based on hopefully population numbers across the state. But it's a Health Directors Association goal to adequately fund mandated services, and it's also one of the County Commissioners Association Human Services, I think H84, I think is what it was. Basically we've asked for $30 million statewide to be added to the public health amounts. Over the past few years, they've cut $500 million easy from our budget. But public health is a rounding error in the state budget. Of the state appropriation for human services, we're at 0.13%. 0.13%. So every time they make a 6% change to everybody else, they make a 6% change to that 0.13%. And we are dying on the valley.
If you could read that budget, you're real good.
Don't ask the state for a quote from it. On the next page, it starts off with FY15 earned. We earned this year $509,000 in Medicaid cost settlement. I signed the attestation statement the other day. Sometime within this next 60 to 90 days, we should receive our check from DMA. That check should be for $458,000. So what we're asking this year is as soon as we have that check in our hand, to budget in the FY16 budget, along with the $212,000 that we've already done, to also increase that by $146,608. And I'm going to go through those things that we have in that request, because that's what you're going to see is the budget amendment from us, and then to carry forward $99,039 into next fiscal year. For this year, I don't know if you know, we've had a challenge since Dan Pulaski retired and finding a physician extender to replace him, so we've had to do a little bit of a salary increase, and we can cover that out of this year's cost settlement. That should be somewhere around $12,000 for this year in additional salary expense. Again, this is not any county money involved in this at all. This is all based on the revenue that we've earned. We want to add a part-time physician, 80% time to the health department. As you know, that we are considered a health provider shortage area here in Macon County. In our last few community health assessments, one of the top 3 priorities has been physician recruitment. And right now, we are being, as unfunded mandates go, the federal government changed the Title X rules for health departments, and now for every woman that we provide family planning services to that does not have a primary care provider, we now either have to provide primary care to that individual, or we have to contract with a provider in the community to provide primary care to that individual. There's not going to be many physicians in the community that can jump on board with that, because as soon as they open up to see our family planning patients, they have to implement the sliding fee scale, the same as we do, that slides to 0, and they have to implement it for all self-pay patients within their practice. So not many people are going to jump on board. So we're thinking we're going to have to provide that service. We actually have a contract physician right now that's working with us from the community here, who's doing part-time hours to help fill in since Stan left until we have an extender. But that should cost us about $51,000 for 6 months. They had a full-time medical office assistant to support that physician. To replace the vehicle, we just transferred a vehicle to EMS, a van that they needed. And we'd like to replace that vehicle. We're also making available, and the sheriff's in the back, I hope he doesn't shoot me, but we have a vehicle that we're going to transfer to the sheriff's department. I think at least the manager and I have had conversations about it, Robbie and I have, for mental health transportation.
Give me anything you want, I don't know.
And then we want to purchase for our OB program that we've been doing, our maternal health program, an ultrasound machine. We currently send a lot of women out for ultrasounds. Every pregnant woman gets at least 2 minimum, and it is costing us some money to do that. And we see an opportunity here with this Medicaid cost settlement money to do a one-time purchase of an ultrasound machine to allow us to do those in-house instead of referring out. And then there'd be an increase in operating supplies of about $10,000 for the year for all of those things. The physician, the added physician costs for the maintenance for the ultrasound machine, and a little bit for our dental programs. And then we ask if we can carry the $99,039 forward that we earned this year into next year to be expended on a couple of positions, and I'm going to talk about them here in a second.
Then back up to the
Yes, sir.
courthouse position, just to clarify that $220,103 in fixed contracting services, is that an overall increase in your budget?
221.
Am I ahead of
I'm looking. I'm on that page. Is it on the page I was just on?
you? Yeah,
The FY15 round?
page 5. Well, I think I'm on page here.
Your page headed?
Yeah. I'm
getting to that page right now.
Thank you.
Yeah. Yeah, it is in the middle of the next page. All right. Next year, that's for this year, for FY15, and you're going to see a budget amendment come as soon as we have the check in our hand for FY15 changes. FY16, we're proposing to increase our revenue and expenses, both based on the cost settlement and to budget the full cost settlement so that we're not having to come before the board to spend that money at the end of the year, like I said before, and that when we receive the money, regardless of when we receive it during the year, it automatically just rolls into our Medicaid revenue fund and stop the craziness with the budget. But basically, we're asking to increase the revenue budget by an additional $277,487. $237,000 of that would be cost settlement dollars, and $40,000 of that is what we're projecting from the increased physician time as far as general clinic revenues or fees, or earned from fees. We want to increase our expense budget by $344,000. That $344,000 includes the $99,000 in carry forward money to continue the dental assistant position and the nurse position that we have in the clinic, and $5,000 that we want to continue in operating or equipment costs that we did for dental and for the clinic out of the last cost settlement fund. And then I think this is the one you were talking about, $220,103 increase in contracted services. This would be to continue the full-time clerical position, and these are something I left out on the last page. I probably should have said is these are all contracted positions, and as long as we're getting this money, we keep the positions. As soon as the money stops, the positions go away.
You're talking about the cost settlement money.
This is cost settlement money.
So in other words, if as long as we're going to budget that money, and as long as we receive it, that's fine. That was going to be a question I had. Just as long as we don't use that money to go toward operating expenses that are going to be there, and then the money goes away, and then that's going to put that $237 back on the county. Just to be sure that anything that we do with this $237,000, whenever that $237,000 goes, whatever we've done with it goes.
Correct. Whatever we're doing goes. And that's why we're keeping all. We're not making these permanent benefited county positions. These will all be contracted positions, the same as we did last year. And
We're non-recurring.
non-recurring. Yeah. So the $220,000 would be an increase in contracted services, and it would continue the full-time clerk position that we have. The part-time physician position, if you guys approve it in the budget amendment we send, to add a part-time dental hygienist to our child dental program, which will generate revenue. Don't know exactly how much, and really don't have time to guesstimate on that to get here today, but we do have a backlog right now of about 60 days to get a child in the chair for cleaning at the schools. So we are trying our best. But we are going to add and see what happens with a part-time dental hygienist. That would not carry forward into 2017 unless it can fully support itself. Because when we move to 2017, in order to balance, that position would go away if it's not earning revenue at all. And then to add the full-time medical office assistant, or continue the full-time medical office assistant position. And then the last part of that is to increase operating by $25,000, which would hopefully be covered at that point by that the physician time and generated general revenues. But again, no county money at this point. No county money. We're not asking for money. We're just asking to spend what we get.
Thank you, Jim. Any questions, Jim?
No, sir. We contract directly with physicians, with professional staff, like physicians, nurses, clerical staff, MOAs. We contract with a company out of Cary, which is actually a sub-organization under the Health Workers Association at the state level, and they do have limited benefits. They can buy into health care. They do get vacation and sick. They get PTO, but they can use it for vacation and sick time. They do not do a retirement plan for those guys, no. And usually with physicians and professional staff, we try and contract with them because if we put them under the state personnel system, where they fall when it comes to salary, we'd never find them to hire. I mean, it just wouldn't happen. It's very difficult to find them in a small county. In a big county, where salaries are significantly different in most cases, it's not as hard. Here, we just wouldn't be able to get one.
You missed the question that you seen, let's say that Evans will be a main county, so we have like just half a food call, outbreak, major, and that's going to come right back to the health department, your department. Where do you have funds?
No, sir.
That, so how would we, if that should happen in our county, extensive, and it happened in one county, an extensive outbreak like a whooping cough or something like that? What are we, I know you're prepared to have.
We're dealing with an issue right now in one of the long-term care facilities that today is the last day, hopefully, and we're going to be out of there. Most of the stuff is done with staff from the department, staff and whatever it is that we're dealing with, and it takes away from clinical services that we're providing directly within the community. We receive a very small amount of preparedness money from the state. It doesn't even pay for a full position in the building. There's no money set aside at the state level anywhere, including the Division of Public Health, to deal with any kind of an outbreak or issue. It all falls back on the backs of the county. And it is required for us to respond as a county under the general statutes.
Only that it says with immediate response.
With immediate response.
So I'm just saying that, it may never happen. We've had that.
Not would we won't have that, but we have dealt with other things. We just had
But that's why the county would just have to sit down with the county and say, look, here's where we're at. You got 300 kids, 400 kids, you got in and out or whatever. You just have to deal with it.
We just have to deal with it. And it can cost anywhere from almost nothing, which is what this one cost us $300.
You have a little fund, you had a fund you could apply for. And that was gone away in 2006.
I was going to say, yeah, that's been, I was going to say about 10 years, but yeah, there is no fund anymore.
Okay.
No money set aside. We used to have a little bit of a small cushion that we kept in the health department budget here under Sam Greenwood. It was about between $6,000 and $10,000 in case that we just set aside, never spent, and that we did away with about 3 years ago.
Gentlemen, any other questions?
Thanks.
Thank you, Jim. And also Tammy Keiser is the operations section administrator. Thank you for being here. Gentlemen, we'll keep rolling. We're pretty close to on-time limit budget.